how to speak or how to say Mandarin and Cantonese in Chinese. I
Okay,
guess.
okay.
Yeah. Since we're learning Mandarin, I guess you can teach us in Mandarin, and then if they, because a Cantonese speaker will know if you're speaking in Mandarin, and then they'll either shake their head or say a little or.
Okay, no problem. Mandarin, actually there, as you know, 普通话, 中文,普通话. From mainland China, if you ask them, can you speak 普通话? They know that you're talking about Chinese. Cantonese, 广东话. 广东话. Okay, I'll write it down. I'll add that. So if they speak 普通话 or 广东话.
Is it up there?
Yes, 广东话. 广东话, yes. Yes.
How would you say something like, please excuse my mispronunciation?
That's a long one. 我的发音不好。
发音。
发音 pronunciation. 我的发音不好，请原谅。Please excuse me， 请原谅。我的发音不好 ，pronunciation 发音不 ，bu 好 ，hao。
哦。发音。
对，我的发音不好。More, come on. The more you guys ask, the more I can help you.
Yeah, so we have a hepatitis initiative, so we have probably some key terms that we would want to know, like what's hepatitis in Chinese?
肝炎，hepatitis, 肝炎。
So liver is 肝。
Yes, yes. 肝炎, yes. More questions? When you first talk to the patient, anything, even just striking on a regular conversation.
How are you?
你好。你好。你 N-I-H-A-O 你好。
What questions should we ask at the beginning, please?
Yes,
height and weight.
height 身高 weight 体重 weight 体 T-I 重 how do you spell it? Z-H-O-N-G Z-H-O-N-G 体重 Z-H-O-N-G 身高 height 身高 yeah, these are the things that will help you guys.
How high?
身高 is a body. Yeah.
Oh. So when they get on the BMI scale, they have to take off their shoes and socks. How do you say, could you please take off your shoes and socks?
Oh, okay.
Please remove shoes.
Also the socks too?
Yeah.
Okay. Socks. 袜子 Shoes. 鞋子 Okay. Take off. 脱掉
Like toilet.
脱掉袜子鞋子脱掉 take off 袜子 socks shoes 鞋子
How do you say
French and like
BMI?
Polish.
Body mass index.
BMI
Yeah.
I don't know. That's like more like a body index, right?
Yeah, body mass.
Body mass.
身体质量指数 is that right?
Yeah, but then can you guys remember that? 身体指数就好了吧? Yeah, just body index instead of it, because a lot of them, when you use too difficult of the words, they may not even understand what that means. Okay.
You said
Well-
Watson, that's shoes? Socks.
袜子。More questions, somebody from the back. No question from the back? Or you guys know it all?
I'm a
Okay.
How do
Chinese
you say
genius.
to get tested?
做测验，做测验，测 OK， 做测验。
Why don't you explain a little bit about, you're saying something about how they think in general, or how Asian patients think in general? I know you were speaking about that.
Yes,
Because you've had a lot of experience working with
right.
Asian populations.
Right. So, from my experience working with the Chinese patient, I found out some of the things that the way they think, and then the way they tend to interpret or understanding, especially when it comes to medication. So what I end up doing is I have some points at the end, which is at the very last page of your handout. I usually encourage them to prepare a list of their medication, and they should carry that all the time. 他们那个药单都是 medication for the reason that because a lot of them, number one, they may take medication from China and then combine with some prescription that they got from here, and they interchange a lot of these medication, and then they have a tendency to stop or to start the medication on their own or change dosage. Okay, especially hypertension. I have run into a lot of patients. They have hypertension, and then they're like, when the doctor asks them, "Are you taking hypertension medication?" "Oh no, I'm feeling fine." So I stopped taking it like a couple months ago. Yes. So, so when you do consult them, you want to encourage them, have their children prepare their name, an index card. Okay, an index card with their name, addresses, contact information, along with their medication list, because they need to carry that all the time, just in case if they run into an emergency. They cannot speak English, and the doctor will need to know what they're taking, okay? And then also, if they do take medication from prescription here, you want to encourage them follow the prescription. Don't change medication, start or stop medication on their own, or sometimes they change the dosage, they will cut it in half, or they will skip one. They have a lot of creative way of adjusting their own medication. So that's something you do want to tell them and let them know that, especially if you are following the treatment from the doctor here, that they want to follow what the doctor's prescription and then have those lists, the medication they're taking along with them. Yeah.
So what about in like approaching the patient? Because I know like in some, like I'm Hispanic, so in like Hispanic communities, it's better if like the female, approaches female.
Yes.
Like if the male wants to approach a female, or a female wants to approach like a male physician or healthcare provider, that's okay. But in general, like I wouldn't approach a male patient unless, he like first was okay with it, and,
For what you guys are doing, I think it's okay. But when it comes to OB/GYN, then yeah, OB/GYN, when it's like female, they prefer female to approach them. But for whatever, because you guys are not talking specific about childbirth or pregnancy or whatever, it should be okay. But in general, yeah, when it comes to OB/GYN, yeah, yeah.
Kind of going along with that, I know that particularly in Asian cultures, maybe other cultures as well, when you speak to somebody that's older than you, use a particular tone, use particular things like please or something. Is there any sort of difference with that? Especially because I don't know if if you're a normal person speaking to them, maybe, but if you're a healthcare provider, I'm not sure if there's a difference. Like when you're speaking to an older patient, are you more direct with them, or do you try to be more polite or something?
I'm always polite. Not just necessary to the older patient. So I guess in general, it really just doesn't matter their age, just approach them with a softer tone. And just make eye contact, and then, you know, just be polite about it. In general, they wouldn't have any problem with you. But then, when you try to encourage them to, for example, prepare the medication list, you need to be a little bit firm in your voice. Even though this is, you try to encourage them to do that, but sometimes you can say it with a smile, but you strongly encourage them to carry, for example, don't start or stop the medication on your own. So it's really just because remember, you guys are authority too, so you're there to give them help, okay? And a lot of time they self-diagnose, they do that, okay? Chinese people tend to do that, and then they will sometimes will combine with the Chinese herbs. So you do want to encourage them, if you are taking anything other than the medication your doctor is giving you, you should let your doctor know, even though they are just, sometimes they see these are harmless herbs, and I'm taking a lot of, you know, herbs, they can get whatever they can get. But you need to encourage them to let their doctor know that they are taking additional Chinese herbs, just in case, because you never know what kind of interaction between the medication and the herbs is doing. So you do need to give them, like I said, give them like, you know, this is very important. So, yeah, they're looking at you guys as like you are the authority too, even though you are there just for the health fair. So.
Well, we're gonna be wrapping things up. Any one or two more questions for Claire? Anyone?
No role play, all right? Can't pick you.
No. How do you say no?
Quick role play.
How do you say, I don't know, how do you say no?
不要 no.
不要.
And that's okay, you know, don't, if you think of anything that we can add to the dictionary and towards the end, and like I said, I will be there along with the two other of my friends, and and you too. And then there's another one from Taiwan too, right? So you guys have a lot of help, right? So no problem there, okay?
All right.
All right.
Thank you so
We're glad to help.
No, thank you. So we'll take some of the questions.
Yes, yes.